So while we've made great progress in ovarian cancer over the last 3 years, and we really have, we've seen approvals for 3 different PARP inhibitors across different indications. We've had approvals for bevacizumab in the recurrent ovarian cancer setting in platinum-resistant disease and platinum-sensitive disease. Who knows, we may have approval for frontline bevacizumab in the United States, which already exists in Europe, but we're waiting here.
Oh, that's exciting.
And then this other drug we haven't even talked about, which is pembrolizumab, which is one of the immunotherapy drugs. That's approved for women with gynecologic cancer who have microsatellite instability in their cancers or deficient mismatch repair protein expression. So we haven't even touched that whole area at all. But that's all happened in the last 3 years. But there's still some unmet needs, so I think it's really important that we don't get complacent. You know, I'm just looking at you and your whole history and what you've gone through, and I hope that this drug works for a long, long time and gets rid of your cancer completely.
I hope so.
But you know,
That's
there's
the
still
goal.
some patients that need more, and so we need to work to be smarter on who we deliver these drugs to, using biomarkers to identify the patients most likely to benefit, those patients that need PARP inhibitor and combinations with other drugs, and what drugs do you pair that with. And then always the future, we need to continue to work hard to understand these cancers completely and find the drugs that are best going to target them. Another really important unmet need, though, is prevention. And make sure that we can wipe this disease off the face of the earth would be fantastic.
Early detection.
Right. You had mentioned, you know, you had a BRCA1 mutation, your sisters or your daughters got tested and they're negative.
Both negative.
But you have a sister, don't you?
I have 2 sisters.
Yeah.
They haven't gotten tested yet.
Yeah. So that's an unmet need, is how can we implement the system better so that when somebody tests positive, we can make it easier for all their family to get tested. They don't have to go to all these different locations to request a test, and just one-stop shopping for all, that we can determine if they have the mutation or not. And if they have the mutation, there's surgeries that you can do to prevent these cancers, or even treatments you can take for prevention too. And now that we know that some of these cancers are coming in from the fallopian tube, the ovary is just a poor innocent bystander. How many women are going to benefit from having their fallopian tubes removed as a prevention strategy? Those are all really important questions that we need to answer still. From your perspective as a patient, and you have, you know, me as your audience and other doctors out there, what would you tell them?
I would definitely say that doctors need to have their patients tested. I'm one of these patients where I look at statistics before I base my decision on what I take and recommendations. So from a physician standpoint, for them to sit down and talk to the patients and let them know.
So share that information.
Yeah, let them know that there's options out there for you.
And really dive into the details. You can handle it as a patient.